What up, what up? I wrote this little thing called Fusion of Horizons of Back Pain, and I'm gonna read it. It's really short. It's just a reflection on kind of where I've evolved to this point. It's hard for me to fix an absolute cause to my chronic back pain and sacroiliac joint pain. The first symptoms of this pain manifested in my body 2 years prior to when the pain reached its chronic stasis, which has lasted now for about 4 years. So let me just pause there and say, there was a moment where this same kind of pain crept up in my back like 6 years ago, and so I guess when I look at my history, like last 10 years, I know there's definitely things that I noticed that were kind of leading. My best theory that I have so far, which is I try to rupture it as much as I can to provide a better way of thinking of the past, is simply that your body adjusts to, my body adjusted to a malalignment, and at some point reached a point where it couldn't adjust anymore, and that's when it became chronic. Though, and as I'll explain in here, I do think that there's quite possibly a mental component of it all. I've noticed that the further I've gotten away from kind of like dogmatic religious thinking into more, I guess you could say, like post-structuralist, hermeneutical kind of assumptions that govern how I think about things, the anxiety in my life has decreased quite significantly, and I'm able to, the back pain has decreased. But nonetheless, the last 4 years have had many evolutions: chiropractor visits, physical therapists, an MRI, a doctor claiming that it was all totally psychosomatic, the discovery and treatment of a leg length difference in front of the backdrop of 8 medical professionals' inability to diagnose my leg length difference, which is kind of interesting because it's 8 millimeters. Since treatment of my leg length difference, I've improved dramatically, though I still have very limited thresholds in relationship to what I can physically do. All that said, I'm able to work a 9-to-5 job that provides needed health insurance, and I am for the most part completely drug free, which I find that a lot of people with chronic back pain, a lot of them get addicted to different kind of medications, and but I've been lucky, and I think now at this point in my life, I'm pretty what's the word, functional. That's what the word they use. I'm able to work a job. It's a pretty high stress job, and I do pretty well at it, and so I consider my situation very fortunate, especially that in this situation I don't have to do drugs, because if I had to take drugs, and occasionally I've tried to take different back medication drugs, painkillers, clonazepam being one, and it really makes it difficult to critically think in a high, fast-paced environment at work. So occasionally I do take muscle relaxers, and my drug of choice is clonazepam. I personally believe that there is a possibility of a mental component, which traditionally mental illness, I don't think that that's a very useful term, but there is a psychosomatic element to this, I am persuaded, to my pain, and I see this mostly with the increase of anxiety. So I know that there's times when either I feel anxiety or some kind of depression, or basically negative emotion in whatever way it manifests itself. That's usually when my back hurts the most. But then I could flip that around and whether one is causing the other or the other is causing the other. But needless to say, I think there is part of that much better. Occasionally, wearing a lift to correct the leg length difference in my, which I do in my shoe, an 8 or 9 millimeter lift. Trigger point massages, regular stretching of all muscles connecting to my with a specialist on Friday. Hooray! And so maybe I could just dwell on that last paragraph just quickly. I really think posture and having the right kind of like chairs to sit in, ones that you can control, like the height and the tilt of the chair, also the back. Some can come in, and some being able to get the right posture when you're sitting, especially for long periods of time, is absolutely critical. Having a cushion under your seat so that your sit bone, because I don't have to like just and the other reality that I'm just really not prepared to be academic in the sphere that I would like to. But it definitely would be more if I could work a part-time job, which is just not something that's going to give me medical insurance right now. So overall, unfortunately,